So again, thanks for everyone for taking time out of your Friday afternoon. I know that Friday afternoons are not always the easiest time to get geared up for a webinar, so we really appreciate everyone's time and attention today for our Jersey Arts Marketers webinar. So we're going to start off with just a few things to give a program update as far as letting you know where things are standing with the Discover Jersey Arts program. So for those who are custom and aware of the People's Choice Awards, I'm sure you noticed that we did suspend those for obvious reasons in 2021 due to the impact of COVID on the field. And the future of those are somewhat uncertain. We've had some conversations with leaders in the Jersey Arts Marketers Network about whether these should come back, or if they do come back, what they'll look like. So stay tuned to see what the status of these will be moving forward. If you haven't already heard about where we are with AIM, Audience Insight Manager is our annual cooperative patron database program. So we have a little under 2 million unique households in this database. Uh, we have just recently closed the subscription window for now, but we will be reopening it again over the summer. We did make this available at 50% off the traditional rates for 2021. And thanks to John McEwen at the Theater Alliance, we were also able to extend an additional 15% off for any theaters that are Theater Alliance members on top of that. And when we open the window back up in June, July, we'll be doing another 50% off even that rate because it'll be for 6 months. So if you're if you're not familiar with AIM, this is a way for you to put your audience data into what's called Data Center, which is a tool run through TRG Arts, which is our vendor for this program. And they're able to use that data and return back to you significantly more enhanced data on your patrons, demographics, psychographics, different profiles. So it's a great way to not only market your programs more effectively and grow your audience, it's also, we've seen it being used during the COVID time as a way to really target your individual giving efforts. And we've heard really good feedback from that front. And in fact, TRG ran a free deep dive workshop for AIM participants. And if anyone is engaging, and I know a lot of groups are engaging right now in deep EDI efforts, equity, diversity, inclusion efforts, this is a good tool you can use to start benchmarking audience data as you start moving forward. So if you want complete details, you can visit artpridenj.org/AIM. And if you are interested potentially in jumping into this, just kind of, you can file away that we'll be reopening it again over the summer. Some ongoing communications that we're doing. We have our Jersey Arts at Home campaign. This is obviously how we're helping you market your virtual events. We've been doing this since last spring, and it's still ongoing. We're marketing it online via social and email. If you want to let us know what you're up to and what events you have going on, you can see the URL there at the bottom, the artpridenj.org/Jersey Arts content. That's where you can submit any events, virtual events that you're doing for consideration. Those events are changed up every week. Emily Ambash on the ArtPride team does a really good job of rotating that content each week and keeping it fresh. In addition, we are promoting any venues that are open, and I know more and more are starting to open, at least in some capacities. So we have this Jersey Arts Sauce Live, and that's where we're placing content for folks so they can see what venues are open. This is not event-driven data as much as it is venue-driven. So if you're a museum and you're open, you can let us know and we'll mention you that you're open and just link over to your website for specifics. And again, this is something else we're actively marketing via those same online, email, and social outlets. We are continuing to produce and promote our feature stories and our podcasts and our video segments that we produce regularly on jerseyarts.com. You can pitch your story there at that same URL, the artpridenj.org/Jersey Arts content. Corin Reif is our marketing communications person at ArtPride, and she also serves as the features editor for this. So she works with a team of contributors, of producers and feature writers who freelance for us. And right now we are also actively looking to expand that pool of contributors. with a specific focus on voices, on BIPOC voices, so that we have more authentic storytelling coming from a wider diversity of voices. So if you know anyone who might be interested in actually being a contributor for us, they can do that online as well at the artpridenj.org/cvjobs. You can get full details on both, again, all feature writers, podcast hosts and producers, video hosts, as well as videographers. So that segues into jerseyarts.com. So obviously we were getting ready to do a big site redesign last February, actually, is when we talked about it. And then pretty soon after that, obviously COVID hit and everything changed. So that had gotten backburnered, but now it's back up to the front burner again. And we are in the process of wrapping up the RFP for the site. And we'll soon be looking for potential developers to help us move into the production phase. Just a quick recap to remind folks that this site is not going to be exactly the same as what the old jerseyarts.com site was as far as its content objectives. It's really going to focus much more on that editorial feature content we were just talking about, those feature stories, podcasts, video segments, that kind of thing. Our seasonal marketing campaigns, which right now are things like at home and live, but eventually we'll get back to promoting live events. Special event marketing, things that we've done in the past, Jersey Arts member deals, Jersey Arts member events. There will be a searchable directory of organizations within that new site. And it'll focus a little bit more on destination marketing. So there'll be like, for instance, there'll be like a Princeton area where you can not only see organizations, but we'll be tying that in to hotels and restaurants and shopping and things of that sort. So we want to focus a little bit more on that. And we're now targeting a first quarter 2022 launch. So we are getting soon to be in the development phase. In the meantime, we have shut down the old jerseyarts.com site. We did that back in the spring of 2020, and we launched this, which is a temporary site, which again is where we're currently housing that editorial feature content. We do have our Jersey Arts membership area there as well, though that's not very active right now for obvious reasons. And we use this and we'll be using this to promote active and upcoming campaigns. So that's my great opportunity to segue and to introduce Chris Rocco. Chris is a managing partner at Spark Creative, and he has been working with us at ArtPride and the council and through a task force of organizations that have been helping us shape the campaign and messaging for a few campaigns that are in the pipeline now. So I'm going to turn it over to Chris and let Chris talk a little bit about those campaigns.
Okay. All right, great. Thanks, Jim. All right, so first up, just a quick update. So there's maybe many of you are familiar with the Arts Reopening Task Force that's sort of been running in the background. And a couple things have been in development. Not only do we sort of work through the Keep Jersey Arts Alive campaign, but that activity worked so well that we've continued it. And it continues with a couple new upcoming campaigns, this one being the first. So here we have summer stages. Basically what sort of germinated here was it became kind of obvious that the road trip campaign, which is the spring campaign for arts and tourism that we do seasonally, spring through the beginning of summer, had some challenges and hurdles and maybe even we could say roadblocks in getting implemented. At the same time, that was a concern. Groups were giving us feedback that they were really interested in continuing what they started last spring and summer, which is really bringing their activities and offerings outside. So that being the case, and that being the thing that works and keeps people visible and keeps patrons engaged, this has been converted through into this new message here that you see, summer stages. And that said, we'll be boxing up road trip, so it'll rear its head again next season, God willing. So essentially, summer stages will be laying the groundwork for the opening campaign that we're working on for the fall that I'll get into in a little bit. It's event driven, so a little bit similar to the at-home promotion cycle. Corin and team sort of curate what is inbound in terms of events and activities, and then they sort of translate that to the web content. This will be similar, backed by a much heavier ad campaign that I'll get into in a moment. So the interesting thing with this is still can sort of continuing the objectives of the tourism side, which Road Trip kind of embodied. This will have the same sort of component where we'll integrate into the DMOs of the state through the web content and social content to pitch what is sort of in and around these particular events. So if there's an outdoor play or an outdoor opera going on, that will be sort of directly connected to the most logical local DMO and any content that we may kind of pull from to maybe highlight that. So this will be, whereas Road Trip kind of operates maybe a little bit more independently, I could see us working more directly with the DMOs to make this as tight of a connection as possible. So overall, I think it's the work with what you got process where we're going to have great outdoor arts options for people, and we'll be roping this into the DMOs who are more expert regionally in terms of what's open and where we can direct people safely and also fluidly. We don't want to send a bunch of people to different things that are closed or present difficulties where we don't have to. This will be in market May through September in varying degrees with its own assigned budget. Media is pretty much a typical spread, including digital retargeting, social. We're going to continue to do some digital radio, which we had great results with in terms of targeting, PR, of course, and then other media that might be available between negotiations and leftover budget. And of course, branded with DGA along with the council, ArtPride, and tourism. So that'll be a part of making this road trip-ish without the hurdles of sending people to places where they might experience difficulty. So I think it'll have a different energy than Road Trip had. And of course, there'll be a toolkit available for this, as typical with Emily, Corin, and Jim and their team. So that's really it for this, Jim, unless you wanted to add anything.
No, I think did any questions come in, or have we had any questions, Michelle?
No, not right now.
I think I
But
saw
just as a
Emily-
reminder,
I think I saw Emily put a hand up.
No, let's do see it.
No. Emily, if you have a question, if you can just drop it in Q&A, or if you have something you want us to bring up. So Emily Ambash on the ArtPride team is the one who will be handling the content side of this. So we'll be able to distribute out you'll get some emails and some social messaging from us about how any outdoor events that you're doing this summer will be able to be included in the messaging for this. We don't have that quite ready yet, but that'll be coming and fairly soon.
For sure. Okay. All right. So on to fall reopening, which I'd say over the past 6 months has been the task force sort of main charge. It'll be in market. These may be a little bit out of order, but it'll be in market September, October, November, subject to change based on scheduling across the groups, as well as this constant sort of back and forth we have, just with our, not just the arts environment, but, sort of our world environment as to, is this the right time? What sort of feedback and vibration are we getting from communities that, our efforts are going to have a return on investment based on when they hit and resonate with people feeling that it's safe and feeling that, globally it's time. There will be AB versions for performing and visual arts. This creative probably is going to exist with a little heavier focus on video than we've done in the past, which will be coordinated with the different venues, creating sort of this narrative of kind of rebirth and coming back to the way things were. Included in that is sort of a core group of local, safe, and open messaging to sort of build on. And then the overarching theme that the task force sort of arrived at with multiple conversations circles around moments. Right now, there's a working sort of title. It's the moments you've been waiting for. I think there's a general craving for this that's been missing, obviously, we're approaching a year now. This is, our patrons are people who are engaged and passionate and they're hunters for this. And I think the cabin fever and the pent up demand for this is pretty strong. So answering that call, we're going to basically be showing them visitor visuals and giving them messages that remind them of what they've been missing. So I think it's really going to create a buzz and excitement. That's something new and new for all of us, as we've all been experiencing. So that's basically where the creative is handled or headed. Mixed media as well. Pretty much the same mix or a similar mix of what we'll be doing for summer stages. The budgets are relatively similar. I think we're going to be taking some of the results data from summer and being able to help fine tune opening to just see the populations, keywords, and phrases that were engaged, different markets, different zip codes. We're going to be getting a lot of data from summer that'll have applications to reopening. And again, this will come with the typical toolkit and information that all the groups will be able to use to remarket this. I think that's all that can be said. It's sort of public for reopening now. It's very much in the developing stages, but between the task force and the ArtPride team, we're very ahead of this in advance, which helps us eliminate cliche and really start to hone the message into something that's going to be impactful. So Jim, I don't know if you have anything to add or if I missed anything there.
No, I would just say that again, like the summer campaign, as we get ready to start building out the deliverable side, as far as like what you'll see on jerseyarts.com, you'll start getting more communications from us about exactly what, how we're going to make it as simple as possible, obviously, if you don't let us know what you're doing, but we'll obviously do that kind of outreach and engagement with you guys through the field to make sure we're getting the right information in so that we know what we're promoting and that what we're promoting is accurate. So.
And I guess one thing that didn't mean to glaze over, but the whole safety messaging and the safety iconography system is something that I know is kind of germinating in the background across all these campaigns. And I know upcoming in this presentation, Diane's going to cover that. So I won't elaborate right now where that is, but I know that's going to be a part of it.
Yeah, that's actually a great segue. So Diane, do you want to pick it up here?
Before we kick into that, Jim, I did want to, there was a question that came in from Sandra. Are there any collaborative efforts planned with college performance venues?
Well, any college performance venue would be applicable. So you could certainly let us know what you're doing. There's no restriction on being able to be featured through this if you are affiliated with a college university. That's not a barrier.
Thanks, Jim.
Mm-hmm.
Okay, well, playing off of that safety message, something different than a typical package that the field will be receiving with this reopening campaign is the idea of a safety graphics package, because the realities of addressing public health are not going away even as restrictions slowly begin to ease, and consumer and client confidence to be a patron at your organization. Now, all of a sudden, you have to be marketing not only the quality of your content, but also how you're addressing public health. Something completely new and different, but essential. So what we'll be talking about now is just a package of tools that we're talking about developing, a package of safety commitment graphics, similar to kind of how you see with the ADA access symbols. So similar to like a wheelchair symbol, except these would be related to safety practices. A symbol for a mask, a symbol for HEPA air purification, things like that. So with that, we'll have John introduce Dr. Weiss and talk a little bit more about how your public messaging can include conversations about public health as well as your quality programming.
Thanks, Diane. So great to be with you all, and delighted that Dr. Weiss has joined us. Just a little bit of background, as some of you may know, we've been working with Dr. Weiss, who is the founder of Intelligent Crowd Solutions, on working with our theaters. We established a reopening committee for our theaters just going on to a year ago, and meet frequently and in all various departments. And Dr. Weiss has been extremely helpful as we're developing procedures and policies at our venues, marketing messaging. We really do believe, as Diane mentioned, the importance of consistency as much as possible across our venues. That's one reason that I think these symbols that are going to be developed in the ArtPride DJA campaign package, I think is really important. Because one of the things that we did recently learn from our Alan Brown Wolf study over these past several months is that we heard that patrons attending arts events, they really want our organizations to be as transparent as possible in terms of how you're keeping your patrons safe. So the more consistency we can provide, the better. Dr. Weiss, as you can see here from the slide, has an incredible background in emergency medicine, as well as working with organizations that are doing large gatherings and special events to ensure that there's safety measures in place. He's been extremely, I can't say enough of how beneficial he's been to our field. So I thank you so much, Dr. Weiss, for joining us today. And I asked Dr. Weiss to share a little bit about some updates, just where we are medically on the pandemic, and then for him to give some thoughts as we're thinking about messaging and signage and these symbols. What are some things that we need to keep in mind? So Stu, thanks again for being with us, and I'm going to turn it over to you.
Great, John and Jim. Thank you so much for inviting me. I'm really excited to be part of this webinar today. So I'm just going to turn my phone off so it stops dinging. There we go. I'm going to spend just a few minutes with you, bringing everybody up to speed so we're all on the same page about what's really going on in the world of COVID and coronavirus right now. Spend a few minutes talking about that, and then a couple of thoughts about the safety graphics and iconography that you'll jump into for as a conversation after I'm done. So let me talk a little bit about where we are with COVID right now. As you all have, I'm sure, been reading, the case numbers are dropping, and they're dropping significantly. The 14-day average of new case numbers is down about 32%. The 14-day rolling average of hospitalizations is down 30%, and the 14-day death number of deaths is down 22%. Great numbers, really optimistic looking directions. However, and I guess there's always a however with this pandemic, I want to just remind people that most of us in infectious disease, and most of us that are been working with pandemic and disaster medicine for a while, we all have been saying that this is actually the eye of the storm. So if you think about a hurricane, right, the leading winds are always strong and terrible, and they blow the water onto the land, and they cause a lot of damage. And we've been through the leading winds of the pandemic. We went from 0 cases to millions of cases in a short time period. And it took us a while as a world to ramp up, to develop mitigation strategies and vaccines and things like that. So now we're actually in the spot that everybody thought we'd be around January, which is we peaked. We've reached the peak of the pandemic, and it's starting to drop. The reason we're not actually out of the woods yet, and the reason that we think this is the eye of the storm, are all of the variants that you've been reading about, right? So RNA viruses, of which the SARS-CoV-2 coronavirus is, the virus that causes COVID-19, are notoriously good at mutating. They have bad reproduction machinery because they're simple RNA viruses, and they introduce random mutations routinely as the millions and millions of copies of virus are made in your body when you're infected. Remember that viruses have to grow inside living organisms. They can't grow on their own. So what a virus does is it comes into a host like us, and it forces our internal cells to start making more virus. It hijacks the very system that our cells use to reproduce and to make proteins, and it forces it to actually make virus. But it does it really sloppily and with millions and millions of copies. If you think about when you make a copy of a copy of a copy of a copy on a machine, you'll know that after a while the straight lines aren't quite straight anymore, and there's random dots or glitches on the paper. You can always tell when there's been multiple generations of copies. Same thing happens with the virus. It introduces random mutations. Most of the mutations are actually do nothing. They're just random mutations that don't change the virus. Sometimes a random mutation makes the virus stronger or more lethal or more contagious. And that's what we're seeing now. There's basically 4 viral variants. There's thousands of viral variants circulating, but the ones that we're worried about right now are the B117 out of the United Kingdom, which we think will become the dominant strain here in the United States in the middle of March. If you look at what happened in the United Kingdom, if you look at what happened in Europe, once B117 became dominant, we saw a dramatic increase in the slope of the number of new cases. So assuming that B117 acts the same way as it did in Europe, it will start bumping up our case numbers here as it becomes the dominant strain. We don't know how steep that curve is going to be, which is why we don't know after the eye of the hurricane passes over us, what will the tailwinds look like? What will they, will there be a steep increase or not so much? We'll know over the next probably 2-3 weeks. The other ones that we're concerned about, so B117 is more contagious by about 30 to 50%. It has a mutation in its spike protein that allows it to stick to cells better and get itself inside of our cells easier. It's a little more lethal. The B1351 out of South Africa is definitely more lethal and has a mutation that makes it a little less susceptible to vaccine protection. The P1 out of Brazil also has that same mutation. And then you may have read yesterday about a new one circulating here in New York. It's actually not so new, but it's actually found a way to increase its dominance in New York. It's the B1526 variant, which has now gotten up to be somewhere around 12 to 13% of all the cases that get genetic sequencing studies. So it's been hanging around. This particular variant's been around since December, but it was really low level. But over the last 2 weeks, it's sort of found a way to go up. So it's the B1526 is something that we need to watch. Problem here in the United States is that we have very little viral genetic sequencing going on. In Europe and in UK especially, they sequence thousands and thousands of cases of virus, and they're really watching what's happening with variants. We're not doing a very good job of that here in the United States. Under Biden, the new administration, they're increasing that tremendously. That was something that was not done on the previous administration. And so we'll get more capacity to do viral sequencing, but right now we don't have a great idea of what's really circulating in the United States. So we're in the eye of the storm right now. We should be looking towards what's going to happen in the late summer, fall, because I think we're going to see life starting to get back to normal. Why is that? It's because of the vaccines. So right now we've got 2 approved vaccines that are out in circulation. We've got the Moderna and the Pfizer vaccine. Both Moderna and Pfizer have announced that they're working on booster vaccines to help cover some of the new variants. Johnson & Johnson's vaccine approved today, has to go through a little more final approval as well, but we expect that that will be out in the next couple of days. So in the next couple of months, we'll have hundreds of millions of vaccine doses out there. And every week, the distribution system of those vaccines gets better and better. In fact, President Biden's wish to have 100 million people in the first 100 days of his presidency vaccinated. We're actually a little bit ahead of schedule. So right now, the United States has about 13.9% of its population has received 1 dose, and about 6.5% of the population has received both doses. New Jersey, the state of New Jersey is a little bit better than the national average. It's 14.2%, according to Vaccine Tracker, in New Jersey have received the first dose, and about 6.8% have received both doses. So what does that mean in terms of the spread of the virus? If you look at the countries that have really gotten their vaccine program together, the number 1 and number 2 country are actually in the Middle East. Number 1 country is United Arab Emirates. Number 2 is Israel. Israel has gotten well above 60% of their population vaccinated with 2 doses. So they're a small country with a very highly evolved medical system, and they've been really out in the front. They've been publishing some good studies recently about what happened to their population. When they got to about 30% of their population vaccinated, they started to see a real significant decline in the number of new cases. And when they got to 60% vaccinated, there was a really significant shift in the way the virus was spreading and the number of people that were actually protected. So we have a long way to go between where we are now and getting up to 30% as the first threshold, and then 60%. When could that happen? If we continue along with our vaccination strategy, and there's no hiccups in manufacturing and distribution, then by the end of the summer, maybe the early fall, we'll be having a big percentage of our population vaccinated. Maybe a little earlier if we get lucky with the 3 vaccine manufacturers creating lots of vaccine. But if you think about 3rd quarter, maybe 4th and 4th quarter, that's the time when you should think about life getting back to normal. So what are the strategies that you should be thinking about when you come up with the safety graphics, right? The main strategy is 1, face coverings. And the big push right now is actually double masking, because double masking actually increases the amount of filtration and protects people better. It's a great strategy. A couple of studies have come out recently that really show, and all along, but some new ones recently, that really show that face mask, wearing a face covering, does significantly decrease transmission. So the 3 strategies, if you go to the CDC website, it's N95 mask for healthcare workers until we get more N95 masks manufactured here in the US. Second strategy is a surgical mask as the bottom layer with a cloth mask over it. The problem with surgical masks is they actually have lots of gaps around the side of the mask. They're not really designed to be protecting people from breathing in. Surgical masks were designed to keep surgeons from putting droplets into the patient. So they're great on the outbound, but they're not so good when you breathe in. So the way to fix that is by putting a cloth mask over the surgical mask so that it pushes the mask tightly against your face and you can actually breathe in and out without the big gaps around the outside of the mask. And the third strategy is actually 2 cloth layers of mask with a HEPA filter in between. And the easiest way to do that is by taking a HEPA filter vacuum cleaner bag and just cutting a piece out and sticking it between 2 cloth layers. That face covering plus social distancing plus hand washing are the strategies that really make a significant difference with both the regular virus and all the variants. And even though B117, the UK variant, is 30 to 50% more contagious, masks actually and social distancing and hand washing really make a difference. So that's where we are in the world of virus. Let me spend just a few minutes talking about when you're designing the safety graphics and iconography. In crisis communications, there's a couple of points that are really important. And as you discuss this, you should keep it in mind. The first one is actually that during a crisis, in general, people lose about 6 grades worth of reading comprehension. It's funny to think, but when we're stressed, and although we're getting more comfortable with COVID, but it's not quite so stressful, this is something that you should think about. When you're writing text or designing signage, you want to design it for 6 grade levels lower than the average grade level of education in the community. So most people in this part of the country have at least graduated high school. So if you take grade 12 minus 6, you'll notice that most of the design communication pieces for crisis communication are designed at the 6th grade reading level. So, and Microsoft Word actually has a bit in it that a feature in it that actually you can tell it to review what you've written, and it'll actually tell you what the grade level is. So when you're designing the signage, make sure that it's at the 6th grade reading level. You want to also make sure that because there are multiple languages and people coming from lots of different areas and different comprehension levels and understanding, you want to make sure that there's a lot of icons and a little less text. I think pictures serve really well, especially when people are trying to glance across something and just get a reminder. Nobody's going to, well, not nobody, few people are going to stand in front of the sign and read lots and lots of text. We want to hit them with some icons that reminds them to socially distance and wear a mask and wash your hands. And those can be done with pictures in a fun way that will attract their attention. You don't want to use it to put it up as the same colors, the same typeface, the same everything as every other sign in your lobby, because then people will miss it. This is a sign you want people to actually notice, and one of the ways to do that is to change up the colors or the text or something about it, put a funny cartoon in it, something that will attract the people's eyes. And the last thing I always like to remind folks is having 52 points on a sign is not going to serve any purpose. Nobody's going to stand there memorizing the whole sign. You want to have one, maybe two, perhaps three main takeaway points that people can pick up in a few seconds when they scan that sign as they're walking in. So those are some important things to think about as you jump into the iconology and the safety graphics discussions. You know, keep it at the 6th grade level. Make sure that there's a lot of pictures and a little bit less text. Have 2, maybe 3 main take-home messages, and make sure that it stands out. Below my picture on this slide is my email address. Please feel free, if you have any questions that we don't get to talk about on today's webinar. I am all about the arts and helping get our society restarted, and I'm happy to answer questions if you just drop me an email at any time. Back to you, John, and Jim, thanks so much for giving me a few minutes.
Thank you. Thank you for that. That was great. I'm going to pause here just to take a moment to reflect on any questions folks have directly related to everything Dr. Weiss has covered or anything else we talked about earlier throughout the webinar.
Yeah, we did get a couple that came in, Jim. First, I just want to bring everyone's attention to a comment that Diane made in the chat that we will be sending out a survey. If you have just a moment to give us a response, that would be much appreciated. It will be a very brief survey. And then in the chat, Sarah Scully asked, how will variants affect cases even after we vaccinate?
Right, that's a great question. And by the way, I forgot to give my disclaimer because I know this is being recorded. Well, everything I've told you is as of Friday, February 26th, 2021. So there's my typical disclaimer, because I don't know if somebody watches this 3 months from now, the numbers will be different. So the question that I heard was, how will the variants, can you repeat that? How will the variants affect?
How will the variants affect cases even after we vaccinate?
Right. So right now, the vaccines are still effective against the B117 UK vaccine variant. The vaccines are still good, but not great against the B1351 out of South Africa, the P1 out of Brazil, and perhaps the B1526 that's in New York. Those all have this mutation in their spike protein, which makes the vaccine a little less effective. Still good. We still recommend that everybody get the vaccine, but it's a little less effective. As I said, Moderna and Pfizer are both working on updated booster shots that will cover. So right now, it's not really clear what's going to happen with the vaccine as it relates to the new variants. I would still highly recommend that everybody get vaccinated, and we'll have to see how the virus responds and how things go.
Thank you, Dr. Weiss. An anonymous attendee in the Q&A just wanted to bring everyone's attention to an international campaign by the International Well Building Institute. And a link to that campaign is in the Q&A. And it looks like businesses can enroll via that website to be part of that campaign to let your audiences and consumers know the safety precautions your venue is taking. Those are the only questions I see right now.
Great. Well, just to, again, to provide a little context. So safety messaging is going to be a very important part of the fall reopening campaign, but also certainly a part of this, of the summer stages campaign that Chris spoke about earlier. So ArtPride is very thankful for its partners at the State Arts Council and with the Theater Alliance, and also with everyone who's been volunteering to serve on the task force to help us make sure that anything that we're promoting and we're messaging to the general public is with the idea of safety being an important piece of this idea of getting folks back out and back and participating in the arts in a meaningful way. So we just want to make sure we thank everyone who's been part of that, and to let everyone on this webinar know that you can continue to expect to see more information to start coming out soon about the details around these campaigns. They are still somewhat taking shape, but we wanted to take this opportunity to make sure the field's aware of everything we're working on. And I think it was great that Diane brought up the idea that we're going to have the survey go out on Monday. So on Monday, everyone who's on the webinar will get an email with ability to download today's slide deck. You'll be able to view this entire video as well. And we'll have that the survey available by then as well. It's gonna be very quick. I know everybody's surveyed out, right? Nobody wants another survey, but this is like a 2-question survey. Just, are you doing this, and which of these precautions are you actively thinking about implementing within your organization? Because again, not every organization is exactly the same. You know, a museum a museum safety messaging is going to be, different than a theater's will be. So we understand there's going to be some variation there. And before we get into the production of this graphics package, we want to make sure that we have the best understanding of the scope of what kind of iconography we should be creating. So we'll be leaning on the field for input there. John, is there anything else you want to add to this piece of the conversation?
If we have time,
Yeah.
Dr. Weiss, a lot of folks have asked questions about communicating with their patrons, the best way to let their patrons know that their space has been disinfected, if they have new air filtration systems. This, of course, from the audience monitor study that we've been a part of. These are things that are definitely on the minds of people when of a comfort level returning to arts venues. And I know I've had a lot of organizations mention, well, how much information is too much information? But we want to let our patrons know when they enter the venue that if we do have a new air filtration system, where should we put that signage? And also the fact that our facility is being cleaned. So what's the best way to share those messages with patrons on either your website and or any signage when they enter your venue?
Right. So that's a great question, John. Patrons, feeling safe in a venue is one of the driving factors when you look at what's going to bring people back into theater and arts types of things. A little less important with the 20-somethings going to an EDM concert because they sort of don't care so much. But in older population folks that are in the arts and they actually do care. One of the mistakes that I see happening fairly often is too much detail. Most of your patrons are not going to care whether you have MERV 13 or MERV 16 filters in your filtration system or how many air exchanges. What they want to know is that you've actually thought about the problems, that you've actually thought about it carefully, and you've taken action to mitigate the conditions that are important, so that you have a good ventilation system, you are socially distancing the patrons, and you have their safety in mind. That can be on the website or in the communication when they get tickets. It's a short, maybe again, 3 or 4 bullet points addressing the space that they're going to be in and the way that patrons are spaced and the fact that the patrons are wearing face coverings. And if you serve food and drink, how are you serving food and drink in a way that's still safe? If you can cover those simple things, again, 3 or 4 points, and just show your patrons that you've actually put in a good amount of effort to their safety, and these are the things you're taking without getting into too much detail. I think, and then give them a place to write. If they want to know what MERV filtration you have, they can write you a note. But you know, that's the kind of messaging that will put people at ease and let them feel like they're not putting themselves at risk when they come into your venue.
That's great. Thank you.
Great, thank you very much.
You're welcome.
Jim, would it be possible to put the slide up with Dr. Weiss's email address on it just before we sign off for anyone who might have missed that? Thank you. And just to reiterate what Jim said earlier, these slides and this recording will be available on the ArtPride website after the webinar. Jim, I'm not sure exactly what time, if people might be able to look for that today or over the weekend if needed.
Yeah, we'll probably have it up by Monday, because normally we try to do it same day. With this being a late afternoon Friday webinar, I would think Monday. Yeah, Monday
Great.
morning. Yeah.
Thanks, Jim. And John and Dr. Weiss, thank you so much for joining us and sharing this important information.
Yeah, so we do have some other virtual events coming up. So the next ArtPride webinar will be Friday, March 12th, back at that normal 10 a.m. time. And you can get information and register at artpridenj.org/COVID-19. Michelle, I know the next public meeting is coming up for the council. That's in March, but we're not ready to release date. You're not ready to release date on that yet, is that right?
We should be announcing that early next week. Yes, so anyone who is on our email list should see an email early next week. And as always, we'll be sharing that on our website as well.
Terrific. We also have the National Arts Action Summit is coming up. That will be virtual, April 5 through 9. You can get details on that at artpridenj.org/action summit. I know that they'll be covering topics including arts and cultural agency funding, arts education, tax policy, of course, COVID-19 relief, and many more. So again, for full details and registrations, there available on the ArtPride site. John, you want to talk about the Creating Change event coming up?
Sure, thanks, Jim. So we do have, we're very excited to be working with ArtPride on our moving toward equity, justice, and anti-racism in our arts community. This will be a virtual event over a course of 2 days, April 22nd and 23rd, from 10 until about 3. We're very excited about the program that's coming together. The first day is going to focus a little bit on history, and the second day focusing on how we as a community can move forward. We have 2 incredible keynote speakers, Nicole Salter, who is a New Jersey actor, playwright, and activist, and Vu Lee, I think, which he's on the second day. I think you're going to find their presentations very inspirational and informative. And I just want to give a shout out to the steering committee of the symposium, Donna Walker-Kuhn, whom I think many of you know, who's the senior advisor for community engagement over at the New Jersey Performing Arts Center, is our chair for this. And we're very excited to be bringing this to you. So save the date information more specifically will be going out in the next few days. And of course, some registration information. So very much looking forward to it.
Great, thanks. And also another save the dates will be Thrive. So as most folks may know, we had the Thrive Arts Conference was scheduled to take place in June of 2020. But got canceled for obvious reasons. It's a biennial event, so the next Thrive wasn't scheduled to take place until June 2022. But with last summer's event canceled, we all the partners kind of got together and thought it would be a good idea to do a virtual event. So there will be a virtual conference It will be a 2-day event as well, although they won't be back-to-back days. There'll be subsequent Tuesdays on June 15th and 22nd, 2021. We don't have a lot quite in the bag yet as far as speakers, but definitely you can save that date and you can stay up to date on what's happening with Thrive at artpridej.org/thrive. And of course, the council is working closely, ArtPride's working closely with the Arts Council and the Lewis Center, and want to thank the folks who are serving on that planning committee, as we're kind of really getting into it as far as putting the program together. And a special thanks to Steve Runk, who is the chair of the planning committee for Thrive. So as you can see, there's a lot coming up, a lot of virtual events, a lot of ways to stay connected. And we want to thank all the speakers today on today's webinar for lending time, talent, and expertise. I hope everyone that tuned in found it helpful. And again, especially considering that we're sitting here late on a Friday afternoon. So we really appreciate your attention and look forward to continuing to work with you all on good safety messaging and getting our patrons back out into the arts as much as we can, as soon as we can. So thanks everybody, and have a great weekend.